Hi, I'm Andrew Kennedy. I'm a physician at the Sarah Cannon Research Institute. I'm Director of Radiation Oncology and Director of Radiation Oncology Research there. So one of the most common effects of solid tumors in patients is that it can spread to the liver. And the liver is a very important organ, and it's one that performs more than 500 tasks every day to keep you healthy and strong. Therefore, when tumors either originate in the liver, so-called liver cancer, or if a tumor in the breast or colon spreads to the liver, which we call liver metastases, we often are stuck in a situation where we cannot remove it by surgery, and chemotherapy may not be fully effective. So adding radiation to the treatment approach has in recent years become very safe and very effective. One of the ways we do that is directing external beam radiation through special mechanisms which we call stereotactic body radiotherapy. And that is just a very technical way of treating a small amount of the liver from the outside. A second way of treating liver cancers is implanting them with tiny microspheres. We call that radioembolization. And we deliver those radiation sources through an artery that feeds into the liver. Both of those approaches have, in the past 10 years, really created quite a significant improvement in patient quality of life and how long patients live. So one of the approaches we use for primary liver cancer would be a combination of surgery, chemotherapy, and radiation therapy, either from the outside or internally through the artery. The most common situation, however, in the United States is that a patient can't have the tumor resected from the liver. And so using this combination of external beam radiation, internal radiation, and chemotherapy has shown to be very effective and is becoming more and more commonplace. For rectal cancer or gynecologic cancer, often patients have GI upset, cramps, or sometimes diarrhea. If we're treating in the head and neck area for a tongue cancer or a voice box tumor, they could have difficulty swallowing or sore throat that would last several weeks. When we're treating in the mid-abdomen, such as the stomach or the liver, we often can cause nausea, and sometimes the patients have more significant problems feeling hungry and trying to eat. So in general, radiation side effects come on gradually through the course of treatment. We have medications and other skin care things we can do to minimize the effect. But unfortunately, when we're giving a treatment that's killing cancer cells, it can cause damage or at least irritation in the normal structures. So most everyone receiving radiation has at least mild side effects. We encourage nearly every patient to consider enrolling on a clinical trial. As opposed to what many people think, clinical trials are not experiments. We're not treating patients as lab animals. It's extremely important to understand that a lot of thought and a lot of the best science goes into developing a clinical protocol. So it represents the very best we have to offer for that disease and for that type of patient. There's also a lot of evidence that suggests that patients that are on clinical trials have the best outcomes and the fewest side effects. This is in part because of the great care of the very many people that watch that you're carefully being treated on the protocol accurately. So I encourage all my patients to consider clinical trials.